So I'm going to ask Carrie Haber, who is the study director for the study, to read a comment from the live web. Carrie?
Sure. So Jessica Liston says, how will advanced practice nurses integrate into current and future delivery care models? An anonymous viewer says, what is the plan to increase the number of students that can attend nursing school? We have a challenge with having enough instructors in the schools. Not everyone can or frankly wants to obtain a PhD to teach. People are interested in nursing. The challenge is getting accepted into programs due to limited space.
Thank you. Lisa?
Thank you. Good morning. I'm Dr. Lisa Campbell, Chair of the American Public Health Association Public Health Nursing Section from San Antonio, Texas. Today I'll share a story that contextualizes social determinants of health, social needs, population health, and population health management. I'm the former Public Health Department Director for Victoria County, Texas. Victoria had a hospitalization rate for adult residents 50% higher than the state rate for COPD, which in adults is a potentially preventable hospitalization condition. The Public Health Department collaborated with community stakeholders to implement evidence-based interventions through community coordination to address the high COPD rates and the associated healthcare costs. Stratifying data by race, ethnicity, and zip codes, persons of color in one of the four zip codes were disproportionately affected. Public health nurses educated the public, elected officials, and advocated for a smoke-free ordinance that voters ultimately passed. The ordinance is an upstream primary prevention strategy to reduce risk of exposure for the entire population for generations to come by changing social norms and behavior. Healthcare stakeholders engaged in population health management in the acute care setting by identifying social needs of COPD patients. Based on the identified needs, the Public Health Department secured funding to launch middle-stream strategies that included linking patients pre-discharge to free smoking cessation classes that included no-cost nicotine replacement and free vaccines. The smoking cessation classes were held in a central location on the transit route. To further address social determinants of health, the Health Department worked with city transportation to evaluate the route use and community need by zip code, and new routes were approved. These efforts decreased hospitalization by 10.5%, charges by 2.3%, and adults reporting smoking from 26 to 14%. This multi-pronged coordinated approach led by public health nurses achieved efficient and effective population health management and improved population health. Thank you.
Thank you. Wow. Lisa. Okay.
Thank you, Sue.
To the second. Thank you. I knew you were going to make it. I could just tell.
All right, good morning. I'm Dr. Shawn Knipe and serve as Chair-elect of the American Public Health Association Public Health Nursing Section. My comments today focus on the systems that will be needed to carry out the work of addressing, quote-unquote, social determinants. What I am not referring to here are interventions to screen and refer individual patients for unmet social needs, as these can readily be folded into nursing practice across all health systems and settings. The upstream work of modifying social determinants at the population level, however, has historically been conducted within the public health system, where public health is financed as a public good. The economic motives, focus of care, and nursing competencies needed in individual versus population level care delivery systems are inextricably linked. These forces have and will continue to impose external constraints on how nurses in different systems can intervene on social determinants of health, regardless of how we might want to re-envision nursing roles to tackle social determinants across settings. To be blunt, modifying upstream social determinants must remain within the public health system, ignoring the underlying motives that feed the U.S. healthcare financing beast could widen health inequities. Yet the public health system has been chronically underfunded, accounting for only 2.5% of U.S. healthcare dollars in 2017. Within it, public health nurses comprise the largest portion of the workforce, where 55,000 jobs have been lost between 2008 and 2017. In the committee's final report, the APHA Public Health Nursing Section believes it is in the public's best interest to unequivocally recommend that for public health nurses to effectively lead upstream efforts on social determinants, there must be an increase in funding for them to do so from within the public health system. Thank you.
Thank you. Good. Public health nurses have it, I tell you. Catherine Miller.
Good morning. I'm Dr. Catherine Miller, and I'm chair for Illinois State Board of Nursing. So I'm pleased to just give a short report from our Illinois board. We currently have 128 pre-licensure nursing programs, and these include LPN, ADN, advanced placement for LPNs to the ADN, BSN, traditional accelerated, and MSN entry. Additionally, there is a paramedic to an ADN program and a medic to a PM program in Illinois. Our pass rates are good from our schools, 89% for PNs and 88% for RNs as an average. There are very few schools that are on probation related to a low pass rate, and Illinois, that's defined as 2 consecutive years less than the 75%. The Board of Nursing in 2006, or 6 years ago, implemented a remediation plan for those schools. There were possibly up to 11% of schools who were on probation at that time. The remediation plan is quite extensive. We insist the programs do follow that, report to the board, which they do, and they successfully have removed themselves and continue to remove themselves from probation. We have 3% of schools who are in that probationary status at this time. Student enrollment has increased and actually doubled in the past 15 years within Illinois into our programs, and our programs, though, have remained consistent at around 128 25 to 28 programs, 100. Student enrollment is approximately resulting in about 7,000 graduates entering the workforce in Illinois annually, which has also increased then about 60% over the past 15 years.
Thank you very much.
Thank you.
Kathy Delaney.
Hello, my name is Kathy Delaney. I'm the current chair of the Illinois Nursing Workforce Center. Since 2014, we've collected biannually data at licensure time on all RNs, LPNs, and APRNs in the state of Illinois. We're one of 31 actually state workforce centers, and we consider our work in the National Forum to be vital to inform the work of the future of nursing. We're trying right now to ask that question of what is the right mix and distribution and capacity of nurses in our state to improve the health of our state. We know, for instance, shortage areas that are going on in our state. Less nurses are entering school nursing, gerontology, psychiatric mental health nursing. We know where the workforce shortages are in our state. We are hoping also that we have collected data on our APRN data. We've added questions on billing with NPI numbers, practice settings, panels, and we hope to be able to gauge the effect of independent practice on these type of variables as we move forward. So I hope the future of nursing considers the work of the national forums and helps us get our work together to show how we can impact nursing. Thanks.
Thank you. Tony Oates. She's not here. Carrie, I'm going to ask you to read another comment in a minute, but if the following could get ready: Robin Shannon, Kathy Yankaitis, Dr. Kay Living, I think that is, Tracy Moorhead, Linda Everett. Carrie?
Sure. So Chidebele Obichi says, many new nurses do not practice in the community, so faculty and students seem to focus more on med-surg and acute care. Social determinants are inadequately addressed in the nursing classroom because students and faculty want to address what is on the NCLEX. How are you working on supporting faculty development to address this shift? Sandra Cotton says, how can we create more collaboration between PhDs and DNPs so we end up with research, rapid cycle, QI, and advancement of nursing science and practice on real-time health questions and concerns, such as social determinants of health that matter?
Robin?
Hello, my name is Robin Adair Shannon. I'm a clinical assistant professor at the University of Illinois College of Nursing. I teach public health nursing, and I am a co-editor of School Nursing, a comprehensive text. 55 million U.S. children attend school at least 7 hours a day, 9 to 11 months a year. Over 20% of these students have chronic health conditions, including mental health issues. Remember that all children who are cared for in hospitals and clinics take their health to school. The remaining 80% are affected by or at risk for a whole host of public health issues, so you can fill in the blanks of your favorites, including 1 in 3 children who live in poverty and whose health is driven by social determinants of health. These trends must reverse. Our children are our nation's future and should be our health care's top priority, a priority that must focus on school health. School nursing is our nation's hidden healthcare system that cares for students and school communities in relationship day in and day out, year after year, so that children can be healthy, learn, and succeed. School nurses are on the front line of primary, secondary, and tertiary prevention, serving as change agents that connect all aspects of the care continuum to improve health equity. Yet 25% of schools don't have a school nurse to address these needs. How do we provide role models in nursing for all children? Make sure that they have exposure to a school nurse. I am here to give voice and visibility to the power of school nursing to economically, effectively, and compassionately care for our country's youth. I speak on behalf of our specialty practice in urging the future of nursing recommendations to 1, prioritize school nursing services in developing collaborative healthcare delivery models between school health services and clinical and community health providers. 2, promote school nursing education. 3, support research on the impact of nursing on student health and education outcomes. And 4, call for funding for school health services to instill a culture of health for our youth.
Thank you very much. Kathy?
I'll pronounce it for you. Thank you for the opportunity to comment this morning. My name is Kathy Youngkitis, and I'm an assistant clinical professor at UIC's College of Nursing, and I'm also the director of the School Nurse Certification Program. However, today I'd just like to comment on nursing education, specifically on preparation. Throughout the Future of Nursing 2020 report and during the town hall today, the importance of education has been discussed. Proper preparation of nurses to address the unique and diverse needs of patients is paramount. In order to provide quality patient and population care, I think that we would agree that basic nursing education must prepare nursing graduates to work collaboratively, embrace evidence-based practice and quality improvement, and acknowledge and address social determinants of health. I assert that all registered nurses should have this knowledge, yet we as a profession seem to be unable to address the elephant in the room, namely that nursing preparation at the associate degree level is insufficient. The ever-increasing knowledge needed for health science professionals has led our colleagues in other health science fields to mandate entry-level preparation at the master's and doctoral level. Nurses need to be educated minimally at the bachelor's level and more likely at the master's level in order to be well prepared to take care of challenges of the 21st century patient. Additionally, I believe as a profession we have an ethical responsibility to lay people who do not understand the varying educational levels in which nurses may enter into practice. In my over 30 years of working with lay people in schools and other community settings, it is my experience that they believe an RN is an RN, having no idea that the preparation can vary widely. Registered nurses without bachelor's degrees in nursing are hired in community settings, having no formal education in community and population health. While the National Academy of Medicine does not oversee nursing licensure, I hope that the Future of Nursing 2030 report will make the strongest recommendation possible regarding nursing preparation. Please push to increase the number of nurses with not just a bachelor's degree, but one in nursing. Thank you.
Okay. Kay Living?
Hi, I'm Kay Livesey, and I have a bad handwriting.
Okay,
I'm
thank
South,
you.
so I should get an extended time period. But anyways, I'm the Associate Director at Western Carolina University School of Nursing based in Asheville, North Carolina. Very fortunate to be one of 3 schools of nursing that has had 2 rounds of funding to promote primary care, embedded, curricular-focused activities, including practicums. So we've been doing that for the last 3 years, and we're starting our BSN residency program in primary care in 2 weeks. Very excited about that. I would like to challenge the committee to consider what I consider the social determinants of nursing. We need to think about how we educate and evaluate nursing practice. We need to be able to articulate the unique contributions that registered nurses make to advance population health. No other healthcare discipline is more broadly prepared, but we live in the intersection of the Venn diagrams of practice and healthcare delivery. We've got to do a better job articulating what it is that we do. People know what nurses do with their hands and their hearts, but most people don't think about what goes on in the head of the nurse. When I walk in my primary care provider's practice and they call the MA a nurse, besides being very upset, we recognize that we've got a long way to go to clarify role and scope. We, as educators, need to get ahead of the NCLEX to prepare nurses not only to serve in roles in the community, but to carve out those roles. We've been working with a partner to embed an independently practicing registered nurse in a low-income senior housing community. She's a great role model for our RN students to see a nurse working autonomously, not as an advanced practice provider, but as a registered nurse. We've also got to acknowledge the power structures that we practice in. We've got to start teaching the business of healthcare early. We lose nurses in 1 or 2 years because we don't really prepare them for the dysfunctional system they're going to work in.
Thank you so much. Linda Everett. Oh, I'm sorry, Tracy Moorhead. Sorry, Tracy Moorhead. Sorry. Saw the little scurry back there.
Thank you very much. My name is Tracy Moorhead, and I'm President and CEO of the American Association of Post-Acute Care Nurses. We represent long-term and post-acute care facilities across the country, providing education and continuing education programs. We have certified more than 18,000 nurses working in long-term and post-acute care in our 20-year history. I want to offer, first of all, my appreciation to the committee for this opportunity today and for the work they're doing on this very important report. I would also like to offer 2 comments. The first at the macro level. I encourage the committee in developing the report to focus especially on the role of post-acute care and specifically geriatric nursing. We need a focus on this area, particularly given the demographics of our population. By the year 2030, the outermost decade that we are looking at in this report, over 60 million Americans will be age 70 or over, and we certainly do not currently have the workforce to support this number of geriatric patients. I would also encourage them in looking at geriatric nursing to include the role of continuing education provided by organizations such as APACN. At the more micro level, given our focus today on social determinants of health, I would encourage the committee to focus on the utilization and development of geriatric assessment tools, particularly focused on the area of social determinants of health. We know from our facilities and from our certified members that there is a unique need for coordination of services in the community to address the social determinants of health presented by elderly patients who are seeking to transition back into the community from a long-term or post-acute care setting. And I certainly hope that that will be an important focus of the final report. Thank you very much.
Thank you. Linda Everett.
Thank you. My name is Linda Everett. I'm a recovering chief nurse executive. Currently, I hold the role of a professor in the Marion K. Shaughnessy Nurse Leadership Academy, Francis Payne Bolton School of Nursing, Case Western Reserve University. The goals of the Leadership Academy are to substantially change nursing education from entry to doctoral level, to introduce leadership content throughout the curricula and prepare every nurse as a leader from bedside to the boardroom. Leverage partnerships with local, regional, and national partners, thereby amplifying the message, it is time for nurses to lead healthcare. Partnerships for education and practice. To reach Robert Wood Johnson's vision for culture of health, we urge the committee to expand and develop the future of nursing's earlier key message of full partner with physicians and other health professionals to explicate the value of diverse and inclusive partnerships to address disparities in health. Social determinants of health. Partnerships must include internal nursing professions organizations, American Nurses Association, American Organization of Nurse Leaders, American Academy of Nursing, American Association of Nurses, National League for Nursing, and Association of Leadership, Science and Nursing, and others. Academic practice partnerships are imperative. External, business, healthcare supply companies, government, local, state, federal, community, schools, libraries, religious entities, civic organizations, philanthropy, foundations, corporations, individual donors, medical associations, state and national, and non-nursing professional healthcare organizations. Thank you for the opportunity to speak. Thank you.
Thank you. I want to remind everyone who's reading their comments to get those comments back to us at Future of Nursing 2030 at nas.edu. Make sure we have all of your comments. At this time, I would like Carrie Haver to read another comment from our live webcast while the following 5 are getting together. Ebony Wright, Kimberly Harper, Judy Sorfel, Vicki Flossie, and Marilyn Pearson. Carrie Haver, go ahead.
Melissa Cole says, it will be powerful to see outcome studies for how nurse leaders at the CEO, COO level impact facility outcomes by focusing on social determinants of health and value-based payment. Tiffany Mattingly says, Whitney Fear's strong statement, take the data and do something with it, resonates with the work I do on a daily basis. I haven't heard much conversation about preparing nurses in quality improvement and data-driven improvement. How do we improve the collection of social determinant of health data and validation and train nurses on how to use that data to improve outcomes and impact on overall health?
Thank you. And these will be the last 5. For those of you ahead of time, for those of you who did not have the opportunity to come to the open mic, please make sure we have your comments. The committee will be very happy to review your comments. Thank you. Ebony? No Ebony? Okay. Kim Harper?
Good morning, or maybe it's afternoon now, I guess. I'm Kimberly Harper, and I am the CEO of the Indiana Center for Nursing and the Indiana Action Coalition. And along with that, I have the wonderful opportunity to serve as the chairman of the board of the Nurses on Boards Coalition, which is an amazing organization that's been spoken about earlier by Coletta, and thank you so much for the coverage that you gave us. But it is imperative that we get the nursing voice to the tables. Because I don't know about all of you, but many of us think the healthcare in America is still a little broke. So we need to fix it. And guess who can fix it the best? We can. So we urge everybody to not take the foot off the gas here. We've got to continue this momentum that we built with the Nurses on Boards Coalition. We need to get the nursing voices to the table. Together we are a chorus that nobody can do anything about because we're so loud, but we've got to do that. We've got to do that together. There's a spot for every one of us, and so I encourage everybody to get involved at whatever level is appropriate for you, at the novice level, at the nurse leader level, at the highest degree. We have spots on boards all across our country, and we also encourage the organizations to encourage outside organizations to bring a nurse on their board or on their commission, get more nurses into politics and into our legislature. It's important that we bring our voice because we have so much to offer and qualities that other folks on those boards just don't have. They don't bring the experiences we do. So we just urge everybody to get involved. If you're not involved in the Nurses on Boards Coalition, we urge you to put your name into our database. We have 6,000 nurses now who have said they serve on a board, and we have more that we want. We know there are 10 times that many out there, but they're not in our database. So we want to be able to count you, and we want to be able to help you find a board if you're not on a board. So I think this is something that really can make a difference in the healthcare of our America, and a culture of health at a community level can definitely be changed by the voice of a nurse on a board. So thank you very much.
Thank you. Judith?
Hi, I'm Dr. Judith Fjell, Professor Emeritus at University of Illinois at Chicago and former Associate Dean for the College of Nursing. Also recently retired as a Chief Nursing Officer at Loma Linda University Medical Center, and I don't know how to retire. So I just, I want to bring to the committee a paper that I was the lead author on. It was a highly vetted, recently published white paper commissioned by the Robert Wood Johnson Foundation, which I think is very relevant. The title is Catalysts for Change, Harnessing the Power of Nurses to Build Population Health in the 21st Century. Nurses are the ideal champions for improving health of populations. We're especially unique in health professions because we're grounded in both the physical and the social sciences. So we have both of those skill sets. And being on the front lines means that we're in a position to identify issues, to work with others to plan and develop and implement and advocate for change. We identified 4 population-focused concepts that should be basic to all nursing practice. They are holism, coordination, collaboration, and advocacy. Those should be in all curriculum and all practice. In other words, nurses should be seeing individuals, families, and groups in the whole and in their environment, and be the connectors and the boundary spanners. They should reduce the fragmentation of healthcare. In order for this to happen, change needs to happen. Nursing education and practice need to integrate population-focused concepts in all the curricula, the roles, and the specialties. We need more research and advocacy support to advance this.
Thank you so much. Vicki Falls.
I'm Dr. Vicki Falls, the director of the School of Nursing at Illinois Wesleyan. My focus today is on the health of nursing education, and specifically the health of students, nurses, and faculty in Illinois committed to seamless academic progression. In Illinois, deans and directors of associate degree programs and baccalaureate degree programs collaborated for 2 years and established a solution to increase our educational preparation for nurses. They included a standardized curriculum for associate degree programs, strengthening articulation agreements, as well as promoting dual enrollment. Despite nurses finding a solution for nursing, our legislators continue to attempt to regulate where BSNs are offered. We need associate degree programs. They are rock stars related to bridging CNAs to LPNs, LPNs to associate degree programs, and producing associate degree graduates. But we need baccalaureate degrees, BSNs, offered at 4-year institutions and higher. My request to the committee is to devote at least a chapter or 2 or 3 to the importance of community colleges and 4-year schools partnering to provide seamless academic progression. Thank you.
Thank you.